So first thing is the introduction. Wash your hands. Greet the examiner and listen carefully to your task. Greet mother and introduce yourself and take permission to play, not say examine with her child. So you will tell, I would like to play with the child. Even in the exam, you can tell to the examiner, I would like to play with the child. So next is the observation. Before starting the examination of the child or playing with the child, before starting to play with the child, you should observe the child. Okay. Observations, stand and look, don't disturb. So it's like inspection. From away, you will look the child without going near to him. Just look for 30 seconds. For dysmorphic features, gait, any abnormal findings, left-handed or right-handedness. So whatever you can observe, you have to comment. Like from away, you will observe for dysmorphic features. Maybe in the exam, in the universal Q, they may give you Down syndrome. So you can describe the dysmorphic features. Then if the child is walking, you will comment on the gait. And then any abnormal fingers, means maybe polydactyly, clinodactyly, or anything you see. If there is a picture of the hand, you see clinodactyly, polydactyly, or syndactyly, whatever you see, you will comment. And left-handedness or right-handedness, always concentrate on that. Then RAPO, go to the child level and try to play with him. Demonstrate for him and ask to do. So you will show him what you want him to do and ask him to do the same. So gross motor development more than 1 year. So usually it's for bigger children. What you will ask? So we will start by their milestones. We all know that by 1 year of age, the child will be able to stand at least, and some children will be walking. Up to 18 months is the window for walking. From 1 year to 18 months, anytime they can walk. So the first thing, for more than 1 year, we will check for walking. So there are 7 types in walking. That is walking forward. Walking forward, 2 types. Like some children will walk, cruise around the furniture. So walking forward, usually it will be by 12 months, they will stand, but they may need some support to walk. Okay. So you have to observe for that. Then walking forward steadily without support. So as I told, 6 months window it is, they can walk properly from 12 to 18 months. So walking supported at least by 12 months, walking steadily by 18 months, then walking backward. Usually you go on adding 6 months here, 12 months, 18 months, then walking backward 2 to 3 years. Then walking sideways is 3 years. Walking tiptoe is also 3 years. walking forward tandem 4 years, then walking backward tandem 5 years. So all for first 3, you will add 6 months, then you will start adding 1 year for each thing. Okay, so again, walking forward 12 months, walking forward but steadily by 18 months. More than 18 months, if the child is not able to walk, he is for investigation. Okay, then walking backward by 2 years, you can keep 2 to 3 years. For 3 years, 2 things, sideways and tiptoe. For tandem by 4 years, backward tandem by 5 years. This is the first thing you will observe in more than 1 year walking. Then after walking, obviously comes running. Okay, so running, he like here we told walking steadily by 18 months. So he should run smoothly, fast, like without anything. It should be by 3 years. But running stiffly, still not very well running. He can run, but not very well. This is 2 years. Running fast and smoothly will be 3 years. And he can also run on tiptoe by 4 years. So after walking, running. So just this needs, even after we finish the meeting, again, you have to go through and make steps to remember how you want to remember. Like walking smoothly comes by 18 months, running smoothly comes by 3 years. That is double of walking. Walking by 18 months, to run smoothly, they need 3 years. Okay, but stiffly they can run by 2 years and tiptoe by 4 years. Next, after running comes jumping. So one by one, as we see the children improving. So walking, running, then jumping. So they can jump and stand in the same place. Okay, jumping and standing in the same place is 2 years. But jumping forward, that is hopping with 2 feet, is 2 years. Mute all. So always remember, jumping in place comes first, 2 years. Then they can jump forward with 2 feet. That is hopping. We also call it as hopping. That is 3 years. Then hops on 1 foot. That is 4 years. And skips 5 years. Each year you are going to increase. First, I will draw for you. So the child will jump and stand in the same place. This is 2 years. Now both the feet, imagine that this is both the feet together side by side. He will jump, but he is going forward. That means he is hopping. He is also going forward with 2 feet. This is 3 years. Then he will hop, means he will go forward, hopping and goes forward with 1 foot. This is 4 years. He will use something to skip, like skipping rope or some means you will have something and he will start jumping like this on the skipping things. Like he may have 2-3 rods of playing. He goes on like this. This is skipping. This is by 5 years. So each step, each year increasing. Okay. Next, we should know the standing types. So you can even, before walking, you can also start with standing. Just 1 second. Okay, then next is the standing. As we all know, the child can stand supported by 9 months. Child stands unsupported by first birthday. Always remember, he can stand unsupported in normal children by his first birthday. Then stands tiptoe 2 to 2.5 years. Stands on 1 feet for 1 second, 3 years. Stands on 1 feet for 5 seconds, 4 years. So again, standing supported 9 months, standing unsupported 12 months, tiptoe 2 to 2.5 years. So keep it as 2 years to make it simple. So from here again, everything you will add 1 year. For every one step of improvement, you will add 1 year. Like stands unsupported 12 months, stands on tiptoe 2 years, stands on 1 feet 3 years, stands on 1 foot for 5 seconds, 4 years. So for everything, you'll start adding 1 year. Next, we have ball. So the toys which you will usually take for gross motor is starting, as he said, first will be your just inspection from away. If the child is walking, you will get to know how is he walking. So gait is already observed, dysmorphic features is already observed. And also while observing, if he is using some hands in with preference, you also got to know the handedness. And if in the universal cue there is hand, you can comment on the hand. All these things after doing, the things you will usually select for the items you have to select for gross motor will be ball. Stairs, usually you have to ask from the parents or from the examiner. I don't think they will keep you stairs to collect. And also if there is a tricycle also, if it is available, you can collect in your things, or you can just ask. This also will go to the history. And also a chair may be needed. That's all. For 1 year old child, mainly the thing you will collect is the ball. Okay. I don't know whether they will keep some small stairs like playing to check. If they have kept, you will collect it. You will ask the child to climb the stairs wherever it is kept. And also tricycle, if it is there, you will take. And a chair is also needed. But mainly ball is the thing which you have to collect for gross motor examination. Okay. So now let's go for the ball. And also if there is skipping rope or something, you will collect. So ball, you will, so he can kick a ball. So ball itself starts by 2 years. Always remember the starting point for ball will be 2 years. Okay. Kicking a ball standing, he will stand in the same place and just kick the ball. It is 2 years. He will be running and kicking a ball is 4 years. So standing and kicking 2 years, running and kicking 4 years. Throws a ball, he can throw a ball again, kick and throw, both standing in same place, 2 years. But throwing a ball is something like just throwing in front. For example, this is the child. Okay, this is a child. There is a ball in his hand. He's just throwing like this in front. He's just throwing in front like this. Will be like, this is 2 years, but he is able to throw high. It should be over the head, high like this. Okay, he can throw a ball over the head, means it should be high like this. It will be 4 years. Just throwing in front like this will be 2 years. And then after throwing a ball, catching the ball. Again, for example, the child is standing here and someone is throwing him the ball. He can just outstretch his hand front here and catch a ball. This is 3 years. but he can raise his hands up like this. He can raise his hands up like this and catch. That is, up outstretched hand is 4 years. Then even if it comes near to the body, like even if the ball comes here also, like very near, sorry, here, if the ball comes very near to his body like this, he can catch up here, means almost to the chest, he can catch up. This is 5 years. Okay, next is bounces the ball by 5 years. So we have to just remember always kick in the same position, standing and kicking in the same position, running and kicking. So standing and kicking 2 years, running and kicking 4 years, throws a ball, just standing and throws a ball 2 years, just like this. But if it goes overhead, it will be 4 years. And catching a ball with front outstretched hand, means long here, he can catch here. This is 3 years, but up outstretched hand, this will be 4 years. And near to the body will be 5 years. Bouncing is 5 years. Next, climb stairs. Always remember to climb stairs. Climbs and goes up and comes down. That is, climb stairs, and also he comes downstairs with assistance. Means he needs someone to hold him to go up and come down. Someone to hold him. He needs assistance, is 1.6 years. Okay. Then climb stairs unaided in child manner. Means he can climb alone, but in child manner, it is by 2 years. And he can climb upstairs in adult manner, but downstairs in child manner, it is 2.5 years. Climbs up in adult manner and climbs up in adult manner is 3 years. Climbs down in adult manner is 4 years. And he can run fluently, very nicely on the stairs by 5 years. So again here, the gap is 1 year, usually 1 to 1.5 years. So he needs some support, 18 months, 1.5 years. That is 18 months. He needs some support both for going up and going down. Okay. But for going up, he goes up in a child manner, both going up and coming down in a child manner. Is 2 years. But he goes up in adult manner but comes down in child manner is 2.5 years. Then he goes up in adult manner and is 3 years, but goes up and comes down both in adult manner is 4 years. Everyone knows the difference between child manner and adult manner, right? Hello?
Yes, yeah. Child manner means 2 steps together.
Yeah, child manner means 2 steps together. Adult manner means 1 step together. So which one comes first? It's easy to go up in adult manner, right? So adult, they develop going up adult manner before coming down. This, if we remember, we can remember everything clearly. He learns to go up in adult manner early. Then ask him to ride a tricycle. So usually rides tricycle by 3 years. So remember that he will be able to ride a tricycle by 3 years. Climbing furniture is very important. He can climb on a chair 18 months, but can't come down. Usually they can climb, but they cannot come down. and they can both climbing and coming down from the chair is 2 years. One more thing you have to do for them is squat and stand. Throw the toy in the floor and ask him to take. Observe how the baby took toy. Okay, so you'll just throw the toy and ask him to squat, or not to squat, ask him to take the toy. So if he's squatting with support of the hand, he needs the support of the hand to squat, it will be 18 months. If he can squat without support, it is 2 years. But I don't know how far it is applicable in the online exam. Okay. So we will do less than 1 year, then we will discuss, then we will revise ourselves. So less than 1 year, what you will do, you will usually, suppose the baby is lying flat on the bed, you will pull the baby from lying flat to sit and then to stand to test for tone and power and then prone. So usually a lying baby will be, who is lying flat, will be made to sit. So what happens usually at 6 weeks, head in line with the body. Means you will not see head lag. They have a tone such that they can maintain their head with the body. Suppose if this is the body, and you lifted them up from here, they should be able to maintain their head in the same position. It should not be down. There should not be any head lag. This is by 6 weeks. So by 3 months, no head lag. In prone, lifts upper chest. Suppose if you put the child prone position, if he is like this, he should be able to lift his chest and head both like this. So at 3 months, no head lag. If prone, lifts upper chest. Then at 6 months, sits with support. If prone, lifts chest on extended arms, rolls from front prone to back supine. So if he is on prone position, he will roll down himself. So rolling will develop by 6 months. Okay, so he can sit with support and he can roll from prone to back on supine. And also here he was just lifting upper chest, but here he can also do the extended arms and lift himself more in 6 months. So 7 months, sits without support. You can keep 7 to 8 months, sits without support, rolls from back to front. Means here he said when he is prone, he will go back to supine. Here, even from supine, he can go back to prone. So first comes prone to supine. Then they can turn supine to prone. Then at 9 months, learns to stand with support, holding on to object, like they will be cruising around they try to hold the furniture and stand. Usually we see that. Then at 12 months, or even between 9 to 12 months, you can say, they start crawling, and usually they will be able to stand by 12 months. Here standing, holding the object, but here they can stand by themselves. They can cruise around the furniture and walking with handheld. Yeah, if someone gives them a support, they can walk and cruise around the furniture. Test for primitive reflexes, basic. 8 primitive reflexes you will check, but in each area you have to remember as 2 each. Like head and neck. For head and neck, you will check for rooting and tonic neck reflex. For arms, you will check for grasp and Morrow's reflex. For the trunk, gallant and parachute. For the legs, stepping and walking. So remember, total 8 reflexes in pairs of 2 each. Means depending upon the part of the body. For head and neck, you will do rooting and tonic neck reflex. For arm, grasp and marrow. For trunk, gallant and parachute. And for legs, stepping and walking. Okay. So before going to fine motor, we'll do one thing. So first comes standing, then comes walking, then comes running, okay, then comes jumping. So jumping again has hopping and skipping, okay. This is the sequence usually, how the child develops: standing, walking, running, jumping. Okay, and then you will give some equipments. The most common things you give is the ball, okay. Then you will check for his climbing of the stairs, and you will give him a tricycle and a chair. That's it. Okay. That's all will come in gross motor. Ball, stairs if not available there. Sometimes we will have the small stairs, right? If the stairs are not available, you will just ask. And also tricycle, if small tricycle is not available, you will just ask. And also chair, you will ask about whether he can climb the chair or come down. If it is available, you can check yourself. So these are the things. So let's start with standing.
Doctora, excuse me.
Tell me.
Doctora, we should ask about all these categories, as you said. I mean, the walking and standing, and then other four, ball and tricycle. We should ask to categorize the baby age.
Yes,
Or,
yes. No. What you will do is in the exam, you will just ask. Suppose if the child is 3 years old, they have given you a child is 4 years old. Okay. So how you will start asking? You have two ways of asking. You can start asking by the gross motor activities of a 4 years old child and go down. That also you can do. For example, what a 4 years old child can do, tell me. He can do tandem walk, right?
yeah.
For the stand, he can do for at least for 5 seconds on 1 foot. He can stand.
Yeah.
And for the walking, he can do tandem walking forward. Okay.
Yeah.
For the running, he can do run on the tiptoe.
Yeah.
For 4 years. And for jump will come hop forward.
Yeah, he can hops.
Hops on 1 foot.
1 foot.
Yeah, hop for 1 foot. And at the 4 years, about the ball, we are doing like kick, then throw, then catch. So kick, he can kick by while running. This is at the 4 years. And for throw, he can throw
Overhead.
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 This
Yeah.
will be on the 4 years. And he can catch again above the head. This will be 4 years.
Yeah.
And for next one was what? Stairs.
Stairs. Yeah.
For the stairs, at the 4 years will be both adult manner is going up and adult manner is going down. Like I mean to say 1 feet per step, he will go up and down.
Yeah.
Okay, then is T is for what? This tricycle. So for tricycle at 4 years, I think we should conclude for he can easily do tricycle. He can do. Bicycle is coming at 6 years. Yes,
5 years.
5 years. Okay, so 5 years we cannot say. We are doing for 4 years, so he can do tricycle easily. So like this, if you are doing gross motor and the child age is 4 years, you should start like ask him if the child is in front of you, you should start from ask him to stand on 1 foot. And if he is able to stand for 5 seconds, for examiner is saying that if it is online, he cannot do. Then come he can stand on 1 second. No, he cannot do. So if he's able to stand on tiptoe or he's able to he's able to stand on tiptoe, child is saying the examiner is saying that yes, he can stand on tiptoe. So your stand age is coming like 2.5 years. Then you will ask for the walk. I would like to ask about child is can walk forward on the tandem on the line. No, he cannot do. Child is walking can walk on the tiptoe and sideways. Yes, he can do. So this is age is coming 3 years for the walk. Like the same way you will ask he can run on the tiptoe. No, he cannot. He can run smoothly. Again, the age is coming for 3 years. Jump on 1 foot forward. No, he cannot do. But he can hops on 2 foot forward. So that is coming again 3 years. Then you will ask for the how is climbing and how is going downstairs. For example, he's going upward with the adult manner, but he's going down with child manner. So again, the age will be 3 years. And he's throwing the ball, kicking the ball like while standing, and he's throwing ball with from the front of the face, and he's catching the ball above the head or catch the ball with outstretched hands. So you will conclude that the most likely gross motor age is 2.5 to 3 years here, like this.
Yeah, but you have to ask all these questions in the
Exam.
in the exam. Yeah, otherwise there is one more option. If you want to start, he's 4 years, but if you want to start at the milestones of 3 years and check if he is able to do, ask the next question also, it's okay. You can do either
Yeah,
ways.
yeah.
According
Yeah,
to
either ways.
you can go
Start
1
from
year
less.
down.
Yeah, start from less 1 years from the actual age. Like if they have given you 4 years of child, so start from 3 years. If he is able to do, then go up. He can able to do at 4 years what you are thinking he's not able to do. That's mean his age is coming 3 years.
Yeah. Suppose, as he said, standing, if the child can stand on tiptoe, okay, you ask, is the child able to stand on tiptoe? Examiner will say yes. Then
Yes.
next, what you will ask, is the child able to stand on 1 foot for 1 second? Examiner will say no. Then here you got to know that, okay, he's doing the 3 years age task. No need to go down. When he did 3 years age task, no need to go down. If he is
Yes.
able to do, you will just ask the next up question and go ahead. Similarly, in
Yeah.
walking also, you can do the same thing. Is he able to walk tiptoe? The child is 4 years, but you want to start from 3 years. So you'll ask, is he able to walk tiptoe? Yes. Is he able to walk sideways? Yes. Next question. What? Is he able to do tandem walking front? He says no. Then again, you got 3 years. Like this. Go from 1 year back and go up. This is also one way. Or if you start from 4 years, he is not able to do, go down. This is also. Anyways, you should remember these steps, what we thought. make the notes and keep on revising multiple times, and then you will remember the steps.
Dr. Noor,
Mm.
Dr. Noor, you told me about the primitive reflexes. So for head and neck, you told us that tooting and tonic neck reflex. For hands, limbs, grasp and moro. For trunk, along with gallant, what other reflexes there?
Parachute.
And for lower lip, stepping and
Walking.
oh, thank you. And one more thing, Dr. Noor Fatma, I saw a few videos of the Mrcpch. They are not mentioning the age of the patient. What I understand from the videos, they are just saying, okay, this is a child, just assess the gross motor development of that child. So you have to assess on their general well-being that, okay, which category he's being and whether he's doing that task as per your assessment, what you assess the age. What I understand, because what I saw, they are not giving you the any age of the child. They're saying, okay, do this gross motor examination and tell us the developmental age of the patient.
Yeah, that is also fine. If you see the child, you can just imagine and go ahead. Also, no problem. Even if they don't give the age, also no problem. Suppose if you think that maybe he's developmentally delayed, he's 4 years, but for you, maybe he's looking like 2 years. Even means overall built also, by built also you're thinking as 2 years. Okay, start your task from the age of 2 years.
But you are assuming that, okay, that could be that age.
Yeah. You are assuming that he is 2 years. Start asking question from the age of 2 years. Like maybe he is 4 years chronologically, but for you, you don't know his age. They haven't given, and you are thinking that he's 2 years old in your mind. So start with the age of 2 years. If he is able to do, go up. If he is not able to do, go down, like this. Start from some age and then decide. You will go up to ask question or you will go down to ask question.
Okay. And last question, doctor. Stand on tiptoe, you told us 2.5 years. Yes?
Yeah.
2.5 years. Stand on tiptoe, and walk on tiptoe is 3 years.
Yes.
Okay. Thank you.
So I want to, it's not there in this book. I am reading from some other book. So finally, after you finish, what do? You will thank the mother and turn to the examiner. Next is, okay, then present the case. So you will summarize your findings in 4 major areas. Mention what things child did and what things he did not do. Or you can say did not demonstrate. Okay, so you will mention to the examiner like the child was able to walk on tiptoe but was not able to walk on but was not able to demonstrate tandem walk today. You can say like this: the child was able to walk on tiptoe but was not able to demonstrate tandem walk today, like this. So that when you examine, this is his child, this is his age. For example, a child is dash years old. All these findings are keeping with developmental delays in the areas of dash and to the age of dash. So you will tell that all these findings are going with the developmental delay in the area of gross motor to the age of 3 years. Means he is 4 years, but your age will be 3 years. So what you will ask, some questions, if you are allowed to ask to the mother, what do you ask? Any concern about hearing, vision? This book is old. It was for old examination, but for here you have history part, right? In the history, these are the important questions you have to ask. Any concerns about hearing and vision? This you have to ask, very important. Okay, and for other than gross motor, if your task is gross motor, other than gross motor, everything you have to evaluate from history, like fine motor, speech and language, and the social. So you will ask what exactly he can say to know about his language. Eating and drinking, how is he eating? Is he using spoons, forks, and drinking with a cup and all those things? Dressing, cleaning and toilet, how the child can play to know his social behavior, any abnormal behavior, school type and achievement. All these things you will be asking in history, what I am telling you. Okay. Suppose this is gross motor, eating, drinking, dressing, cleaning toilet, how the child plays, all is the social history you will be taking. What exactly he can say, what orders he can follow will be for speech and language. So for fine motor, you can ask, what can he draw? Is he able to draw circle or not? If he says no, then you will ask, is he able to draw an vertical line? No, then horizontal line. Then is he able to scribble like this? Some questions you have to ask about fine motor also. Then school type and achievement. So how do you present the case? For example, today I examined Ali, 5 years old, who has distinct features consistent with Down syndrome, and he is able to build a tower of 9 cubes, build bridge and train, but not able to make steps like this. For example, in the cubes, you will tell he is able to build a tower of 9 cubes, build bridge and train, but not able to make steps. He is able to draw circle, but could not draw cross. He is holding crayon in modified tripod fashion. He can cut paper with scissors smoothly. He can insert lace thread in a large bead, but not in a small one. He can fix 3 shapes in a simple board. He can turn page one by one on the book. All these findings are keeping with the age of 3 years in the area of fine motor. Like this, everything you do, what you do in fine motor, 3C and 3B. Next, when you go to fine motor, you'll get to know. So you will tell every point what he is able to do and what he is not able to do, or he was not able to demonstrate it to me today. Like this, you can say what he is able to do, what he is able to demonstrate, what he is not able to demonstrate, and give his age. Okay. So now we will go to fine motor. Anyone has any comments before we go to fine motor? So let's go to fine motor, developmental and vision assessment. Again, we'll first go to the elder children, that is more than 1 year. Ask about the age if the examiner did not tell you. Okay, that's left to you, them. If they don't want to give the age also, you can just give them the developmental age, whatever you find. Next is here, what I tell you is remember as 3C and 3B. Okay. So the 3C will be cubes. So cubes, crayons, and scissor. Scissor, the SC, the C of the scissor, the second letter of the scissor. Okay, not to get confused. 3C and 3B. So cubes, crayon, and scissor. And then you will go for beads, book, and board. That's it you have to do in fine motor. 6 things, 3C and 3B. So let's go for the cube. So cubes, you will also you will always check for building of tower. Okay. So for at 12 months, he'll just bangs the tubes together, bang like this. He'll just bang it together. That's it. So he can start building from 15 months. Okay, so you can think that by 15 months he can build a tower of 2 cubes, and by 18 months 3 cubes. Okay, then it increases 6 cubes by 2 years. Okay, 9 cubes by 3 years, then 12 cubes by 4 years, and 15 cubes by 5 years. So usually what we are doing here is multiplying by 3, age into 3, like 2 into 3, 2 3s are 6 cubes. His age is 3 years, 3 into 3, 9 cubes. His age is 4 years, 12 cubes. So if the child is able to make 12 tower of 12 cubes, that means he's 4 years. You will divide it by 3. So if you know the age, suppose that the examiner told you the age of the child is 4 years, do the developmental assessment. So for a 4-year child, 4 3s are 12. You multiply by 3. He should be able to demonstrate for you a cube of 12 cubes, means a tower of 12 cubes. If he is not able to demonstrate a tower of 12 cubes, that means he is developmentally delayed. You will come down. You will check, is he able to demonstrate a tower of 9 cubes or not? So the chronological age into 3 from the age of 2 years, okay, from the age of 2 years, the chronological age into 3 will give you how many number of cubes he is able to demonstrate. If he demonstrate building the cubes less than what is for his age, like for a 4 years old child should demonstrate 12 cubes, tower of 12 cubes. If he is not able to, you will think that he is below, he is 3 years. So just remember, the chronological age into 3 will give you the tower of number of cubes he is able to build. Okay, this is from 2 years age. Before that, just remember 2 cubes for 15 months, 3 cubes for 18 months. That's it. Okay. Then we all know that there are pictures. I will show you the pictures from other book after this thing, or if I can show here. So building of bridge, train and steps. Bridge of 3 cubes and make train. He can make a bridge of 3 cubes and make train by 3 years. Okay. So just by reading, we will not understand. We should draw this. So here, like this is the bridge. This is a cube. And this is one more cube. And this is one more cube. If he is able to do bridge like this is 3 years old. Or if he is able to build a train like this, one behind the other, he will be 3 years old. So bridge and train for 3 years old. Then cubes, 3 steps of 6 cubes, that is 4 years. 4 steps of 10 cubes, this is 5 years. This I will show you the picture. Okay, maybe here it is. This is the cubes of this is the stairs. So using six cubes, he should be able to build 3 stairs. So 3 cubes here, 1, 2, 3, then 2 cubes here, then 1 cube here. So he is able to, how many cubes he used? 3, 6 cubes, and he is able to build 3 steps. 1, 2, and 3. So this he can do by the age of 4 years. And using 10 cubes, he can build how many stairs? 1, 2, 3, 4 stairs. Okay. So again, you see here 4, here 3, this is 7, 8, 9, 10. So he used 10 cubes and he's able to build 1, 2, 3, 4. If he's able to do this is 5 years. So always remember stairs will start only from 4 years. Okay, stairs is from 4 years. So this is what he was telling. Bridge of 3 cubes and make train, and 3 steps of 6 cubes and 4 steps of 10 cubes. Okay, the other book I shared, you were able to see the pictures, right? Or no? Hello?
Yes, we could see.
Okay, thank you. Because I thought maybe you did not see. Okay. Next was the crayon and paper. You must observe the way he holds the crayon. This is very important. Always comment on holding of the crayon. Before you say what he draws or scribbles, always ask the examiner, how is he holding the crayon, or how is he holding the crayon is very important. Crayon or pencil, whatever. So crayon and paper, you must observe the way he holds the crayon and mention in your presentation. Okay, so there is here one picture for holding the crayon, but I don't know, here it's not there. I'll share you that later. So you should know, scribble, just scribbling, to and fro scribbling, 15 months. He can do circular scribbles, 18 months. Always remember, vertical line will come before horizontal line. Just remember, in 2 lines, which lines come first? Vertical line comes first. So vertical line by 2 years. Horizontal line by 2.5 years. So circle by 3 years. Along with circle, he can also do T, V, H. Means, see, all these letters are using horizontal line and vertical lines and slant lines. Okay, so he will be able to do these things. Then copy, cross, write X, O letters by 4 years. Copy square, 4.6 years. Copy triangle, 5 years. And also they can write some letters related to curves, because by 3 years they know how to write a circle, right? So after 3 years they can write all the letters related to curves like this, C, U, and this is like lines will come before that, even L lines, A also almost lines. So even the curved letters and the letters with lines also they can write. So copy a diamond by 6 years. Okay, so always you should know that you do and then the child copies is different, and imitating is different. There is 6 months gap between imitating and copying. Okay, you do simultaneously, the child will do with you is imitating. You don't show the child, you do it and ask him to, after doing, you hide from the child, you draw the circle and then show him the circle and ask him to draw. This will be copying. Okay, so I will share for you the pictures for these drawings. So as I told you, just to remember, not to get confused which comes first, vertical, horizontal. Just remember one thing, vertical line comes first. That's it. That means at 2 years, the child is able to draw vertical. But before that, we should remember these things, that he is able to scribble. Okay. Scribble something like this, to, fro, like lines, to, fro, like this before 15 months. But at the age of 18 months, he does circular scribbles like this in the form of circle. Okay. Then 2 years, he can draw a clear vertical line, 2.5 years horizontal line. Then at 3 years circle, 4 years cross, 4.5 years square, and 5 years triangle. Okay. This is about this. You can also add here diamond. He was telling diamond, right? Diamond for 6 years. If you want, you can add it. No problem. This is about the drawing. You should know basic things. You can make the drawings near this book when you are reading to keep it, to know that what he can draw at what age. Next, draw a man test. Draw a man test is n is equal to parts of body baby can draw. Okay. Draw 3 parts in draw a man test, 3 years. Draw 4 parts plus head in draw a man test, 4 years. Draw 8 parts plus head in draw a man test is 8 years. For this, you have to see the picture, otherwise you will not remember. Okay, so I'll share the picture for you. This is draw a man test. So we read 3 years, 3 parts, right? So this head is 1 part. This is upper limb, 2nd part, and this is the lower limb, 3rd part. This is the 3 parts. Is this draw a man with 3 parts? This is the 3 parts. Okay. Is it clear? So he can just at 3 years old, okay, so at 3 years old, he can just draw a circle like a head, put dots for the eyes, and this is 1 part. The circle is 1 part. This is upper limb is 2nd part, and this lower limb is 3rd part. Okay. Next, for 4 years, they can draw a man with 4 parts. That is, this is head, 1 part. This is trunk, 2 parts. I think this is upper limb, 3 parts, and this is lower limb, 4 parts. Like this, better than this. There is something called trunk here. This is an extra addition. You can take this much as trunk and these 2 as limbs and these 2 as limbs. This is 4 years, 4 parts. Then 5 years old, there is some extra. This is the head, and he can make a trunk like this. And this is upper limb, and this is the lower limbs. Okay. So 1, 2, 3, 4. But I don't know how he is telling 6 parts. He is taking each as 1 part. 6. 1, 2, 3, 4, 5. Anyone has comments on draw a man test?
Hello?
Yes.
Eyes are considered 1 part actually. I think so.
Limbs is 1 part.
Yes.
Yeah, then if we take limbs as 1 part, here he can do only 4 parts. 1, this is trunk, 2, this is 3, and this is 4. Right? Yeah.
Yes.
But at least, I mean, we should see the improvement only here. Here, there is no trunk only. Directly, he attached the limbs to the head. Then here, at least some trunk is there and some limbs are there. Here, a good trunk is made. Anyways, this is what he has given.
Maybe doctor, like head is one, consider head and trunk considered as 1 part, and 2 limbs considered to be 2, and then 2 lower limbs considered to be 2. So total 6 parts he can draw. Can be like that.
Yeah, but here what he has given Khidr sheet, if you take like this, for example, here 4 parts plus head. Let's apply here. And this is 1, this is 2, this is 3. I don't know, this is 4. Again, it will not come. Maybe if we take separate, it might come. 1, 2, 3, 4. Yeah. If we take separately, this is 1 part, this is 2 parts, this is 3 parts, and this is 4 part.
Head and eyes are 2 parts actually. Limbs are, I don't know. Yeah.
But this is what is the picture they have given here. Okay, actually, let's find out about RAHMAN test from some other source, no problem. So this, for this, there is a picture here. The pencil holding, immature tripod, cylindrical grasp. Okay, good tripod, digital grasp, dynamic tripod, that is modified grasp, adult fashion is the tripod grasp. Okay, good control and paintbrush, 5 years. So if we remember like this, we cannot, it needs some picture. There is in another book, I don't know, in this book I don't have this picture. I will take the picture and share. Just 1 minute. So this is the picture. If you can see, this is the grasp. Like this is called cylindrical grasp. And here, if the child holds crayons like this, his age will be 1 year to 18 months, 1 to 1.5 years. Then digital grasp, if he is holding like this, like what is shown in the picture, it is called digital grasp and it is 2 to 3 years. Then another, he holds little better, modified tripod grasp. This is again 3.5 to 4 years. Then 4.5 to 7 years, tripod grasp. Okay, all of you are able to see this, right? Just remember this picture, how the grasp changes. This is the first one, 1 year to 18 months. This is the cylindrical grasp. Next is the digital grasp. Just add 6 months from here. We said 18 months, till 18 months this grasp. Then from 2 years, it improves. This is the digital grasp. You can yourself hold the crayon in all the 4 grasp and try so that you will remember. Then after 3.5 to 4 years, there will be modified tripod grasp. This is the one. And then tripod grasp. Okay. So next, scissor and paper. This is the third C we are reading. Scissor and paper. Cannot cut the paper straight. He cannot cut it straight. 2 to 2.5 years. Can cut the paper straight, 3 years. So he is able to cut the paper straight by 3 years old. That's it. Then beads. Just in beads, 2 things, large beads and small beads. Large beads with large holes, 3 years. He can lace the large beads with the large threads. This is 3 years. Small beads with small threads, 4 years. Okay, book of pictures. When you give the book, he can turn many pages together. It is 18 months. Turn page by page is 2 years. So this is just for small children. If you get everything for 3 years, no need to check this. Then boards. Always remember the age and the years and the number of shapes he can fix. 2 years, 2 simple shapes. 3 years, 3 simple shapes. But for 4 years, he can do more, 6 simple shapes and also complex shapes, okay, for the board. So 2 years, 2 simple shapes, 3 years, 3 simple shapes, 4 years, 6 simple shapes and complex shapes. So you should also check for the pincer grasp. Okay, they will have crude pincer grasp by 9 months and palmar grasp by 6 months. Fine and mature or neat pincer grasp by 1 year. So crude pincer grasp by 9 months, mature pincer grasp by 1 year, palmar grasp by 6 months. So other things, less than 1 year, 6 weeks. Oh, okay. Just now we will go for less than 1 year. We know that the 6 weeks old child will fix and follow 90 degree. 6 weeks can fix and follow, but the angle will be less, just 90 degree, and grasp reflex will be there. If you keep the fingers in the hand, the baby will grasp it. That is palmar grasp. Then at 3 months, this 90 degree will become 80 degree. Fix and follows 180 degree and can hold some rattles in the hand if you give. Then at 6 months, whatever they hold in the hand, for example, a cube in the hand, they can transfer into other hand. They start transferring the objects, and also if you give rattles, they shake the rattles in the hand. Okay, and they also have a tendency to put the, for example, you give cubes, they will put in their mouths, and also there will be palmar grasp. This is for the 6 months. Then at 9 months, we read already crude pincer grasp. So there will be early pincer grasp, and they try to reach for small objects. If any objects beside them, they want to take it in their hands, they try to reach, release objects, and also look for any fallen objects. If you throw any objects, they will look at it. And also any small objects around them, they try to reach. That's how they slowly start crawling, you know. From 9 months of age, they have this urge to take the things, whatever is around them. So they try to reach for objects, and slowly they start crawling. So reach for small objects, try to release the objects and look for any fallen objects around them. Then 1 year, mature pincer grasp, they will have points by index finger and object permanence. Can someone tell me what is object permanence? Let me see. Anyone? Object permanence?
I think, Doctora, if you hide an object from the baby, he will still looking for the area you hide. Other one, if he is small, he will not think of that, as if it is not permanent.
Yeah, means you hide and he will be searching where it went like this.
Yeah, he will, at the area you hide, he will check again.
Yeah, he will think where it went like this. Yeah, you're right. So this one will be by 1 year. Yeah. So a note, if fine motor assessment, it is important to ask about concern regarding vision. Vision and fine motor is very important. And one more thing is missing here. You can also assess about color. You can, in the C, you can also add, if you have time, you can ask about color as well. How you will ask for color in fine motor?
We will show the color, any red color. We will pick any cube and we will say, can you please take another the same?
Yeah, yes. Suppose you will not take the name of the color. You will just take some colored cube, like for example, blue color, and you will ask him, can you give me the same colored cube like this?
let him to identify, recognize.
Yeah, yeah.
Yeah.
Or you can ask him, can you give me the same colored toy like this? He
Yeah.
can give you. Yeah, this is the way you ask. This is to differentiate from the speech and language station.
And in the speech, we, on the contrary, in the speech, we have to show and then we will tell him to utter which color is this.
Yeah, that is expressive speech. For the
Yeah.
receptive, you can ask like, show me the another red colored toy. You will say the color name in speech. Here you will not say the color name. You will ask him to pick the same object. Same color object. Yeah, this is one thing you can add it. Okay. So I will just go through this page because it's very important. Here, see what is it written: common medical conditions and many professionals in the child development services involved in care of children with developmental problems. Okay. So here, we'll just read the case and see, this is a case, okay, case history 4.1. We'll see the case and we'll also read the multidisciplinary team associated with it. Complex neurodisability. Lucy, the second born child, was born term by normal delivery. Her mother had been in good health throughout the pregnancy, apart from minor flu-like illness at about 17th week of gestation. So this is a Lucy. She's a second born child, term baby, normal delivery. Mother was at good health, except at 17 weeks of gestation, she had some flu-like symptoms. Shortly after birth, Lucy was noted to be excessively irritable. Her feeding was poor and she had microcephaly. She has microcephaly. She failed her newborn hearing screening test and was referred to a pediatrician. So after birth, they found the child was irritable, poor feeding, microcephaly, and failed hearing screening test and referred to pediatrician. A MRI brain revealed extensive bilateral abnormalities. Congenital cytomegalovirus was diagnosed and she had profound bilateral sensory neural hearing loss. Okay, so this is the case. Then what happened? Her complex neurodisability was managed by the Child Development and Allied Services. The common medical problems and services provided are shown in figure 4.11. Over subsequent months, she had growth faltering, developed clinical features of cerebral palsy, global developmental delay, and subsequently developed epilepsy. She required gastrostomy and bilateral cochlear implants. So if in such a child who has global developmental delay, she has cerebral palsy, developed epilepsy also, and she also need gastrostomy because there is faltering of the growth, there is growth faltering, and also bilateral cochlear implants because she has bilateral sensory neural hearing loss. This was because of the congenital infection. Here the cause is congenital infection. It's not preterm. The baby was born term, but mother had some flu-like symptoms at 17 weeks. Maybe this was the source of infection to the child. So the child had congenital cytomegalovirus with bilateral sensory neural hearing loss. So she was on bilateral cochlear implants and there was global developmental delay, epilepsy, and cerebral palsy. So what were the teams? In all developmental station, you will have the question on the teams. So we'll just go through all the teams here and remember. So hearing, this is the, I think, what problems the child had. Then we will go to this. This is the common medical problems you face with this child. So hearing impairment is common. So in any developmental station, in history, hearing and vision is very important question. If you don't ask, you will be undermarked. So hearing impairment is common. Visual, cortical visual impairment and other visual difficulties in 30% you see. Orthopedic, what do you see common in cerebral palsy children? Hip subluxation and dislocation. They may have fixed joint contractures, dynamic muscle contractures, painful muscle spasms, spinal deformity, osteoporosis, fractures. So mainly, very commonly you see this hip subluxation and dislocation. Okay, all these. So you have to involve the orthopedic team also. So in urogenital, because of usually they are bedridden, there is no much movement, and stasis can cause repeated urinary tract infection, delay in establishing continence. So they may also have incontinence, unstable bladder, vesico-ureteric reflex, neuropathic bladder, bowel and bladder, So depending upon the involvement of the area and how extensive the central nervous system is involved, they may have all this: neuropathic bowel and bladder, vesicoelectric reflex, unstable bladder, delay in establishing continence. That means they can have incontinence, urinary tract infection. Then gastrointestinal, gastroesophageal reflex, oromotor incoordination. They can have oromotor incoordination, aspiration of food and saliva, a percutaneous endoscopic gastrostomy. So PEG tube is considered in these patients, and constipation. So we all know that cerebral palsy, they will have constipation. They may need gastrostomy tube for their feeding, and they can aspirate food and saliva. So there can be repeated lung infections. They will have problem in their muscles of the tongue. So they need oromotor. They have incoordination. So they need speech and language therapists to improve this, and also gastroesophageal reflex. Then respiratory infections, aspiration, pneumonia, chronic lung disease, sleep apnea. Neurology, they may have epilepsy, microcephaly. This patient had microcephaly and epilepsy also. They can have macrocephaly and hydrocephalus, cerebral palsy. Then nutrition, poor weight gain and faltering growth. Behavior, what are the behavioral problems you see? Organic or reactive problems, sleep problems, sibling behavior, parental distress. So the parents may be under stress. So social history, if child like this comes for the developmental station, social history becomes very important. Are the parents under social stress and distress? And the behaviors of the siblings, does the child has sleep problems or organic or reactive problems? So this is very important, child developmental services which are involved in these patients. So let's first start with the pediatrician. Okay, so what is the role of pediatrician here? Assessment, you will assess the child. Investigation and diagnosis. So first you will assess, you will investigate, run the investigations and come to the diagnosis. Coordination of input from therapists and other agencies. And also you are supposed to coordinate with the other agencies. Okay, and also input of therapists here means you will coordinate with the physiotherapist, occupational therapist, speech and language therapists, and play therapist, all these things. Okay, and also other agencies like social services, education, healthcare plan for the children, education, healthcare plan, social care, and other agencies, coordinating with all the therapists and other agencies. This is the work of the, actually here it should be pediatrician can assess, investigate and diagnosis. For this coordination comes community pediatrician. Okay, the role of community pediatrician is to coordinate these therapists. Then referral for specialist tertiary. If the child needs tertiary assistance, it will be referred by the pediatrician. Then neuro disability services as required. Example, complex epilepsy or spasticity management. All these, the referrals and the coordination will be done by the, as far as I know, it's written in MARC, it's community pediatrician who will coordinate with the therapists.
Doctor, your screen is not there.
Screen is not there, but I shared, no? It's as shared, no? Now?
Yes, yes.
So why you did not tell me before? But did you get the case? Okay, at least you got the case what we are reading, right? Okay, okay. For everyone, you can see the screen now. Hello?
Yes, yes. Yes.
Okay. Now, as I know, I told you, community pediatrician plays a role for coordination. Coordination with therapists. Here the therapist is the physiotherapist, occupational therapist, speech and language therapist, and play therapist. And other agencies like social worker and education like school, nurse, and education healthcare plan for the child, and also the health of the child. And also if needed, they will refer to the tertiary neurodisability services to manage their complex epilepsy and spasticity. So now we will start with the physiotherapists and orthotics. So what is the role of physiotherapist? Balance, mobility, and postural maintenance. So for their gross motor things, usually physiotherapist is for the gross motor improvement activity, balance, mobility, postural maintenance. Their aim is to prevent joint contractures, hip subluxation and dislocation, spinal deformity, mobility aids, and arthrosis. So orthotics, that is the arthrosis supporting shoes, and for their any mobility aids like crutches, and also to prevent joint contractures, subluxation, spinal deformity. Their main aim is to improve the gross motor development of the child, balance, mobility, postural maintenance, all these things. Next, occupational therapists support for activities of daily living. Daily living activities like washing, feeding, toileting, dressing. So all the social activities will also come here, like feeding, washing, toileting, dressing, and writing, eye-hand coordination, and sitting. So here, fine motor, the fine motor part is the improvement of the fine motor and vision part is taken by the occupational therapist along with the daily activities. So for occupational therapist, two things: eye-hand coordination, he will improve this. Writing of the child, this is again fine motor action. And seating, as rest all this, what feeding, washing, toileting, dressing, seating, all these things will come under his daily activities, which will be a part of social also, social development. Speech and language therapist, it is for speech and language and communication development. Suppose in the child who cannot develop the communication by talking just, they will use other things like augmentative and alternative communication aids. These are the alternative communication aids other than talking. That is the sign language, Mrcpch sign language, British sign language, touch screen communication. Okay. So you should know all these are the sign languages where the child cannot speak and communicate. In the children who cannot speak and communicate, they will teach them the sign languages. These are the things: Mrcpch sign language, British sign language, and touch screen communication. So any idea how they do touch screen communication? No one knows how they do touch screen communication.
Probably they use a computer screen.
Just go back and check. This is something new development they are doing. Okay, this is in the new book, new illustrated book. We have to check and know what exactly it is. Okay, because these questions they can ask you in the developmental station. Next is the educational services: preschool education support and assessment, educational psychological assessment of functioning and cognition, and advice and support regarding educational placement. Like you will evaluate the child. Does this child need special schools, or these children can go to regular schools with assistance? All these things has to be evaluated depending upon the child's present condition and how much of his activity is affected by the insult. Now here What has happened? This is a case of prenatal insult. The mother had an infection at the age of 17 weeks and the baby had congenital infection. This is a kind of prenatal insult, right? Because of that, the child. So you will assess the child's development and decide over, does he need special school or he can be managed with the same school with assistance or not, means with the normal school. No, I'm telling in general. So what happens? Preschool education support and assessment, and then education psychological assessment of functioning, cognition, advice and support regarding education placement. So where do you place this child, in special school or in a normal school with assistance? All these things will be decided by the educational services. Next is the specialist health visitor. So what does the health visitor do? Health visitor will also, like the community pediatrician, she will also helps to coordinate with the multidisciplinary team and multi-agency care support and signposting for families. So they will support the families by helping for arranging the respite care. That is for the social service. Sorry, this is the specialist health visitor. The specialist health visitor will coordinate with the multidisciplinary team and also the other agencies and give support to the family. Then orthoptic and ophthalmologist, again they will evaluate for any vision problems and give the solutions, like if they have squint, they have myopia, all these will be treated. Then dietitian, advice on feeding and nutrition, social care and occupational therapy. So what do they do? Again, housing adaptations, even this occupational therapy here, both you should combine these two things for occupational therapy. Housing adaptations also, okay, like easily the child should go to the bathroom should be easily available, and they modify them to sit on the chairs easily, like this. Housing adaptations, advice on benefits, that is disability, mobility, housing, respite, short breaks, voluntary support agencies, all this comes under social care, okay, like giving respite care to them, short breaks to the parents, taking care of the child for the short breaks and the parent can take some rest. This is the short care, respite care. Then voluntary and supporting agencies, house adaptations will come under occupational therapy, okay. And also they should advise them mobility is important to prevent contractures, and also modification in the housing and all those things. Next is the audiology for hearing problems. Then child psychologist is needed in cases of autistic spectrum disorder assessment and any behavioral problems. Okay, this is the note of multidisciplinary team for this. And also there should be something called play therapist also here. You should also have a play therapist. So anyone has any comments before we end the meeting?
Dr. Noor, I have one doubt this regarding the color. In case of this speech you told, no, that we will not tell the color, but we will tell the color. No, then he will tell us. He will express this is the red color or like that.
No, this is for if you are using color for vision assessment.
No, for VN that is okay. That is matching. That is okay. But
That
for
is- For
yeah.
speech, there is two things. One is expressive and one is receptive, right?
Yes. Yeah.
So how you will ask for expressive?
Expressive, we will tell any cube, we will show the any color. So then he will tell red color, yellow color, whatever the
You
color.
will ask him a question. For expressive, you will ask him a question. Like you will take a red cube in your hand and you will ask
Yes.
him, what is the color of this cube? You will ask him a question. He
Yes.
will say, this is red color. Khalas, he passed in expressive speech. Now, he
Okay.
did not answer you. What is the color of this cube? He did not answer you. So
Okay.
you will ask him in receptive manner. Like,
Like same as in case of this the VN, same color he will bring like receipt, I think.
no. You will ask him.
Hmm.
Wait, I will tell you. I forgot how to ask in receptive. 1 minute, I will tell you. Same like you ask for other things in speech and language in the same way. 1 minute, I will tell you.
Like the means obey the command, like show me this, then he will understand and then he will give us.
Yeah. Show me the red color cube like this. So for now for always for receptive, you will tell what it is. Like show me the duck. This is receptive. He will show you. Like what is this? You will point your finger on the duck and ask what is this. If he says this is a duck, this is expressive speech. You will ask him where is the duck. He has to point. This is receptive speech. And similarly, you will ask where is the red color cube like this, or you will ask show me the red color cube like this. This is receptive. Okay, so you will use the color name in speech, but in vision you will not tell the color name. This is what I want to tell you. You got my point?
Yes.
Yeah,
Right.
you will take the name of red color, like show me the red color cube. So he will show you. This is he will show with his finger. This is the red color cube. Khalas, this is receptive. He understood and he responded to you. But in the vision, you will not use the word red. You will take the cube in your hand, ask him, show me the same colored cube without using the name of the color. This is what is the difference. Okay.
Okay. Thank you.
Okay, thank you all for attending. Maybe in the next session, we will do social. A speech we had done before. If we do social, then we can do some development cases, inshallah.
Thank you.